Welcome everyone to this evening's webinar. Thank you for joining us for this Cancer Screening Quality Improvement Initiative wrap-up webinar. My name is Rebecca Paget. I'm the Program Development Officer from Nepean Blue Mountains Primary Health Network, been managing this program for this year. I'd like to extend a warm welcome to you all this evening and to our guest, Natalie from Cancer Council. Just as we get started with this evening's webinar, I would like to acknowledge the traditional owners of the lands on which we're all meeting this evening. So here in Penrith, on Darug land. So I'd like to pay my respects to elders past, present and emerging, and would also like to extend my respect to all Aboriginal and Torres Strait Islander people and non-Aboriginal people here present this evening. Just a quick bit of housekeeping. If you can just keep your microphone on mute just while we're presenting, just so there's no feedback. If you do have a question, pop it in the chat box. There'll be opportunity to ask questions as well though. If you want to jump in, feel free to keep your camera off or on, whatever your preference is. This is our agenda for this evening. We're going to talk through the data from the program. And then we're going to hear from Natalia. Then we're just going to look quickly at the sustainable quality improvement and the action plan at the end. So the learning objectives for this evening are to gain an understanding of the program results by looking through the data, gain an understanding of the support services in the region for cancer patients, and learn strategies to ensure sustainable continuous quality improvement from the cancer screening program. Just as we do get started, I would like to say big congratulations to you all. It's been another big year, and we're already sort of nearly halfway through 2023, which sort of is a bit crazy to think about. I would like to acknowledge all the work that you've done over the 9 months, and yeah, we're sort of readjusting to what the new normal is after COVID, and there's been lots of other things. So I think yeah, it's really encouraging to see cancer screening remain a priority in the area, despite all of the challenges that have been happening. And I did just want to touch again quickly on the aims of the QI program. And sorry, just give me 1 second. Just going to flick this over here. That's a bit better. Just to remind us again of the aims of the program. So this program aims to increase the rates of breast, bowel and cervical screening within the eligible population, and practices do this by establishing accurate cancer screening participation rates, identifying patients who are overdue for screening, establishing an effective cancer screening reminder system, and delivering patient-centred care to those at increased risk of not participating in screening. So there were 3 key measures that we looked at in this program. We looked at the mammogram results, we looked at FOBT, and we looked at this cervical screening. So I'm going to go through some of the data that we've collected over the course of this program. This data is from clinical audit number 1, which was done in November last year. The final data will be released midway through May. So that final data I'll send through as a report with the information from this presentation as well. And then you can sort of compare where the final results were. But did want to give you sort of a bit of an update at least of what we've got. And so I guess for the mammograms recorded, we can see in the 3 months that we've got the data from for now, there was a slight increase from sort of 26 to 27%. And one practice did increase their mammogram recordings by 3%. So there's a little improvement there, and that's good to see after 3 months that there's already a bit of an increase in that. And similarly with the FOBT recordings, there's been a slight little increase. But I did just want to compare it to the percentages that we had last year. You can see that overall the FOBT rates are higher, especially in the male population. So it's exciting to see that the progress, since last year's programs. And the final measure that we looked at was the cervical screening too. So there's been a slight increase in that first 3 months, with one practice particularly having an increase in 7% by 7%. So it's good to see, initially the small changes that have happened right at the beginning of the program. So it'll be good to see the final results when they come. Now, this is the graph of the mammogram recordings for eligible female patients. So these are the ones who have had a mammogram recording done during the course of the program. So you can see the grey zigzag line is a baseline recording, and then the blue bars are the first clinical audit. So that's sort of where your practice is sitting at the moment. There's a discrepancy there, and that usually happens when you start to clean up your data and start to accurately record, get your patient records to kind of match up and identify correct patients. So we expect a little bit of this in these initial graphs. So it's okay, don't stress too much. You can still see some changes and some progress. And practice 6 gives us an example of their baseline level up to where it's sitting now at about 30%. There's been a 13% increase. So you can sort of see the pattern of what we're looking for. And it gives you an idea of what to look out for at the end of the program as well. But it's good to just see some of those changes happening. I included these ones as well because these are the eligible patients with mammogram overdue. So this is a good cohort to look out for as well, because these are the patients that you need to keep working with. So you can identify these through PenCat, but we keep it all de-identified and we don't get any patient data information anyway. But you can go in and find the list of these patients. And so these are the ones to be looking out for and to continue doing the QI activities with these ones. Same here with the FABT recordings. So these are the numbers that have been recorded, and we've got the baseline and the audit 1 results. Practice 6 had a good increase there as well. And there's been an increase in practice 7, practice 9 and 10 and 11. There's probably a discrepancy with the data and the data cleansing. So it'll be good to sort of see what happens at the final data, and then we can compare it with your raw lists, make sure that the data that's being pulled is actually accurate. So even though it looks sort of scrappy, it still gives us some really good information to work with and helps us to pinpoint where we can start looking at, identifying some of those patients well. Here we've got the same, the FABT overdue. So these are good patients to sort of consider, reaching out to, or opportunistically having discussions about being involved in the cancer screening programs, the FABT program. Here we have the FABT recordings for eligible male patients that have been recorded, and these ones which are overdue. And then finally, we've got the cervical screening for eligible female patients as well, and patients with the cervix. So this is the one with that they have been recorded, and then this is the one that are overdue. So I've kept them, both of the graphs in there, so that you can get an idea of where you've come from and what's been achieved, and then also the patients to kind of continue focusing. And just as a quick little snapshot, these are the actual numbers recorded in the first 3 months. So remember, this is just the first 3 months of the program, so there's still another 6 months of data that we'll get at the end, which I'll put into a report and send out to you. So we will get the final data, but just for this evening, it's a snapshot of what's happened at the beginning. So it's really good to see the progress that's happened there as well. So looking forward to the final results. So I have sort of mentioned this a little bit as we talked along, but these results do give us an idea of what's happening with the percentages and the numbers and practices and, what's happening with your patient list. But it helps us to kind of improve the accuracy of the screening register. And this is something that you can continue working on, and especially because the final data won't be pulled until the beginning of May. So you do have another week to kind of go back and check through if you wanted to. We can look at those graphs and sort of see where there's places to do some data cleansing there. But I think a really good part of this program is seeing where the data gets scrappy and where you can start to look at making some of those improvements. So it can just highlight that. And then also part of the program, also in the clinical audit reports, we provide the participation rates of practices in this program and then practices in the Nepean Blue Mountains local area in general. And you can see that most of the levels are pretty similar, but those practices participating in this program, the bowel screen is particularly good this year. So that's great. Really good to see, good engagement there. And also, I think the other thing of this program is that it helps us to see the areas that we can be making those changes, but it's good to approach it as a team because different members of the team have different ideas or different ways of reaching out to those patients. So just a reminder to keep thinking as a team and keep making those small little changes with the data there. So that's it in terms of the data overview. I will provide more information in the final report, so that will be sent out to you. But now it's my pleasure to introduce Natalia Armas, who's from the Cancer Council, and she's going to share with us this evening an overview of some of the amazing services that are provided by the Cancer Council in our area. So just bear with me 1 second while I swap PowerPoints.
Thanks very much, Rebecca. And just while you're getting that up, I did want to say hello to everyone. Thank you for coming on today. It's really good to see such a great turnout. And hopefully you'll be able to learn something new about Cancer Council and what services are available for your, patients and the wider community out there. So my name is Natalia. I am the community coordinator for Cancer Council. I look after a number of different programs and services, including preventions. I go out to organisations, to schools, to community groups, and we talk a lot about prevention. But I'm here today, of course, to let you know about what we actually have on offer at Cancer Council for people affected by cancer. Rebecca, there's quite a few slides. I was going to say, rather than me saying next slide, I might just kind of go like that or something, and hopefully we can go through it. So a little bit about us. Cancer Council is actually 96% community funded, so we don't get any funding or grants from the government. Oh, we do apply for grants, but we're not funded by the government. We are Australia's leading cancer charity, uniting the community, providing support, investing in research, and ultimately saving lives. Together with our volunteers, supporters, stakeholders, and staff, we are committed to reducing the impact of cancer now and into the future. Okay, so what do we actually do? So we believe that a cancer-free future requires an integrated approach working across 5 strategic priority areas. So we work towards a cancer-free future by conducting and funding world-class research, preventing cancer, supporting people affected by cancer, and also advocating to ensure that governments take action. So a little bit about the information services that's on offer. If you can remember one thing out of today, it would be this number, which is 13 11 20. And it is the Cancer Council information and support point of contact. I suppose we don't like to use the word helpline, but it is the central point of contact for all cancer-related services from anywhere in New South Wales. So this gateway is staffed by oncology health professionals who provide free information and support, and they include linking callers to local support programs as well as to Cancer Council programs. The 13 11 20 number also provides free, confidential, professional psychosocial support and referral to support services, as well as a follow-up call from provided trained volunteers. It is important to note that this service is available to everyone, including healthcare professionals, GPs, social workers, and the general public. We definitely encourage all healthcare professionals to refer all cancer patients to 13 11 20 for support and information, and also if you have any other questions yourself. So perhaps one of our most recognisable assets is our Understanding Cancer resources. These resources are the core of our evidence-based information for those affected by cancer. It's written in easy to understand and language and comes in a variety of formats, including more than 64 printed and online resources, including booklets, online fact sheets, ebooks, CDs, comprehensive online content on the website. It is important to note that these booklets as well provide an introduction to the topic and can be supplemented by other information from the healthcare professional or other specialist organisation. So as you can see, there is a snapshot of the resources we have available. And if you would like some hard copies of these resources, let me know and I can definitely organise that for you as well. Thank you. Information podcasts. So I'm assuming that most people know, or hopefully everybody knows what a podcast is. It's not part of our Understanding Cancer resources, but they are definitely growing in popularity. So the thing about cancer, which is what our podcast is called, is hosted by Julie McCrossan, who's a former ABC presenter, also a comedian. And she is actually a cancer survivor herself. So she hosts these podcasts along with cancer experts, as well as people affected by cancer. So she, interviews them. The benefit of the podcast is that you can listen anywhere on a computer, tablet, or smartphone, and they are in digestible length. So about 30 to 40 minutes ago. A lot of people currently going through cancer or even the carers actually like to listen, whether they're on the train or on a commute or sometimes as they're receiving their chemotherapy as well. So as you can see there's a number of different topics, including carers, family and friends, coping with cancer, diagnosis and treatment, managing side effects, and advanced cancer. So you can just go onto our website or you can download them on iTunes or the Play Store. So legal and financial services. As you can see there, we have quite a significant reach in New South Wales and have provided nearly $1 million in financial assistance, helping over 150 people in financial counselling. And we fielded over 2,500 telephone calls in relation to just financial. Unfortunately, for most people going through cancer, sometimes the cancer diagnosis itself is the last thing on their mind. It's always the financial and how am I going to get through? How am I going to pay the bills? How am I going to get to work? That ultimately is more of a stress burden for people. So we offer financial counselling. Financial counsellors act as a negotiator and an advocate for people who are experiencing financial hardship, and their service is free, confidential, and independent. Just some information there about what else they can do, managing debts and assistance, and applications to make changes towards mortgage or credit card payments as well, and information about consumer rights. Next slide. Financial assistance, help for people experiencing acute financial hardship. So this is currently on an eligibility criteria, so you do have to apply for it. And generally, we say that people who are able to receive Centrelink payments will receive these assistance. However, there are some, instances where people are maybe asset heavy, but then they don't have cash flow, so they will be available to get this as well. But it is a one-off $350 payment towards bills, food and fuel, and then an additional $350 payment going towards the cleaning or gardening for people undergoing through cancer treatment. The payments are made directly to the service provider. And it is important to note that it's one per person. And so that means if a person has had cancer and then 5 years later they get a different cancer, unfortunately, they're not able to get that $350 payment again. Next slide. The referral process for financial assistance is quite easy for you. If you do know anybody that needs it, it's as simple as just calling that 131120 number or asking your client to call directly to the 131120 number. There is an email, if you would prefer to do email, which is clientservices@nswcc.org.au, and we will be able to get in touch with a client going from there. Okay. So pro bono, which is one of our favorite and least known program, we actually connect people affected by cancer with a volunteer professional in the community who will provide advice and assistance. They're usually usually the people will meet professionals in their office. However, assistance may be provided via video, phone, and email where needed. If you speak a language other than English, we can also arrange a telephone interpreter for you. Okay, so the pro bono program provides professional support in the way of legal services such as wills, power of attorney documents, employment law, and credit disputes. Um, I've heard a lot of stories actually where this has been turned around in quite quickly. Generally, what happens is, unfortunately, when people go into hospital and they're at the end stage of their cancer, which is usually because it's caught quite late, these things have to act quite quickly. And I think I know of at least 5 in the last month or so where, we're able to get wills turned around within 24 hours, all for free, which is quite amazing. And, it's something for families and the patient going through it, just a bit of a relief, and they can then spend that precious last 24 hours spending that time together. There's also financial planning, which includes superannuation, insurance, debt management, and access to Centrelink. Then we have small business support, which includes managing a business during a diagnosis, managing business debts, and succession planning. Then we have workplace advice, which is, speaking about workplace entitlements, dealing with discrimination, as well as returning to work. So who's eligible? The cancer patients themselves, the carers, and also bereaved carers, which is, as you can see there, up to 1 year post-bereavement. So just to note that, especially with legal matters, it is on all issues that's related to the cancer diagnosis. So for example, we don't do any family law or criminal law, for example. It has to be directly linked to the cancer diagnosis itself. It can't be that, well, they have a cancer diagnosis, but they're also going through something else at the same time. And yeah, the service is means tested for free assistance, which means that, again, usually if they're able to access Centrelink, they will be deemed as eligible. Okay, next one. What we can't assist with, as I mentioned before, legal issues not connected to cancer, which example, a neighbourhood dispute over a fence. That seems to be quite a common one for some strange reason. I can understand why, but yeah, we do get asked that quite often. Bankruptcy and personal taxation, family law, as I mentioned before, or property settlement, medical negligence, criminal law, estate administration following the death of a person, and advanced healthcare directives. So those are things we can't assist with. So the service aims to fill the gap of free legal services that already exist. So it's, not trying to replace legal aid or anything like that. Next. Financial planning, as I kind of mentioned before, accessing super and insurance, debt management, Centrelink payments, and managing lump sum payments. Next, the workplace referrals. I'll just, let you have a read through yourself. Okay, and then practical support. Next. So the information service, this is one program that is quite close to my heart because it's basically volunteer-run information services based at the Cancer Centre. Our closest one is in Penrith, and I actually manage the beautiful volunteers that work out of the Penrith Cancer Centre. And their role really is to provide, social, emotional support for people going into treatment or potentially going into their first appointment. And they are all trained. A lot of the volunteers have actually been through cancer themselves, or they've cared for somebody with cancer. It's something that I think a lot of people generally don't see, the benefits of speaking to somebody who's already gone through it themselves. They do also refer to Cancer Council services as well as to um, the local services that's available. Next. So webinars, these are for free and they are all evidence-based. So as a lot of you would know, as soon as somebody gets a diagnosis, a lot of people generally will go online and go to Dr. Google. But we have quite a lot of different types of information. And again, like I mentioned, besides just printed, we've got webinars, which is free on the web for cancer survivors. It's recorded, so you can watch them again another time, and it increases knowledge and gain strategies to help survivors continue their lives. Next. Next again, emotional support. So this is just a bit of a snapshot, and I will go into detail about what we actually offer. But Cancer Council peer support programs are all professionally managed, facilitated, and moderated through identified best practice. These pillars represent our suite of complementary peer support programs: Cancer Connect, telephone support groups, the Cancer Council online community, and the support group leaders and counselling programs. So client feedback on their experience of the peer support confirms that 92% of clients feel better informed, 89% are more able to cope, 85% feel less isolated, and 94% were reassured by peer support. So our Cancer Connect program is a peer support program offering cancer patients the chance to talk to a specially trained volunteer who has been through a similar diagnosis and experience. Cancer Connect may provide unique understanding, practical information, and emotional support associated with shared life experience. Cancer Connect is available at diagnosis, before, during, and after treatment. This service is also available to survivors. Cancer Connect peer support is provided by people who have had a similar cancer experience, has been trained, and are supported by health professionals. Okay. Telephone support groups meet over the phone, providing community, emotional support, practical information, and breaks down the barriers of isolation. So people who are isolated by their cancer experience due to location, the type of cancer, or need for confidentiality can access this program. This program brings support to people. It's particularly helpful if people are geographically isolated, are balancing work and cancer, or they are unwell or caring for someone who is unwell. Twice monthly support groups via teleconference. There's usually about 3 to 8 group members, and there's always 2 health professional facilitators. So current groups for the telephone support groups include advanced cancer, brain cancer, breast cancer, myeloma, and melanoma. Next. The Cancer Council online community offers people currently living with cancer, the cancer survivors, families, carers, and the wider cancer community in the opportunity to connect, share experiences, and find information and support in a safe forum. So at least 82,000 newly diagnosed people will search online for information each year, with approximately 42,000 people visiting an online support group forum at least once. Research shows that the provision of online information to people affected by cancer helps them to get control, reduce anxiety, improve their adherence with treatment, create realistic expectations, promote self-care, and also generate feelings of safety and security. Through blogs, discussion forums, and support groups, members can discuss their experiences and share stories, tips, and coping strategies to help normalize concerns and reduce social isolation. What's most appealing about the platform is its accessibility. It's available 24/7 and from any online device. These are closed groups. There are closed groups for sensitive issues, and the entire website is moderated and community managed by qualified health professionals. Okay, next. Cancer Council New South Wales is committed to also ensuring that patients have access to high quality community-based support groups. Support groups provide a safe place for people affected by cancer to come together to support each other, develop friendships, share ideas and thoughts, obtain information from health professionals and each other, and learn coping skills in a non-judgmental and caring environment. We can help connect people with local support groups, again through that 13 11 20 number, but we can also assist new and existing groups in many ways, such as starting a new group, identifying the type of group that will best suit the interest and the needs of the local area, giving practical advice on how to start up and promote the support group, and linking with local health professionals and a Cancer Council local office. Next. Sometimes people affected by cancer, their families and carers need to talk to a professional counsellor. Often these people face challenges locating appropriately experienced and affordable counselling services. The counselling program has been developed to help refer people to qualified counsellors who are experienced with the wide range of issues around cancer. So services can be provided face-to-face or via telephone. The standard cost per session is $100. However, people experiencing financial difficulties will be assessed for a financial subsidy. Following contact, the other thing is obviously there is the mental health care plan as well. And people are able to receive up to 6 counselling sessions. Okay, so that pretty much sums up the programs part of things. But locally, I did want to let you know that there is a local event happening that is for cancer survivors as well as for the wider community, which is the Penrith Relay for Life. I'm not sure whether anyone here might have heard about it, but it is on the 27th, Saturday, the 27th of May at Penrith Paceway. And if you go to the next slide, please, Rebecca. We're basically inviting people who have been through cancer to be our guest of honour. There is a morning tea, which is provided for free, but the Penrith Relay, it used to be 24 hours. It is only 12 hours now due to COVID and a few other things. The idea of it is that community groups, organisations, businesses create teams. They come along to the relay. They fundraise for Cancer Council. Usually they do it in honour of someone as well. Of course, you don't have to. It is an opportunity for you to also promote your local business to locals. And generally people will then walk around in a circle around the track. And we have quite a lot of different entertainment as well as ceremonies, which is, which is very touching as well. But that's it for me for tonight. Does anyone have any questions?
Thank you, Natalia. That was really great. Very interesting. Very helpful to know a bit more of a idea of the programs that are operating. Yeah, feel free to unmute and ask a question if you have one to Natalia, or pop it in the chat. That is fine too. But thank you. It's really, I think it's exciting to hear about those programs, especially like you mentioned, the ones that are less known. Yeah, that they're available and there's support, and particularly I think the legal support, that's really, I can see that would be really beneficial.
Mm-hmm.
Yeah, yeah. Thank you.
Welcome.
Just while that's going, I'll just bring up my presentation again and we'll continue on. So if you do have any questions, just feel free to pop them in the chat, but we'll just continue on. Now, I just wanted to hand it over to you guys. Is there anything from the program that you wanted to talk about, that you wanted to share? Were there things that you found were helpful, interesting, anything that you thought was sort of new and that you were, you found was really helpful? Or also, I guess, were there any challenges? So if anyone wants to share, feel free to jump on and let us know. No pressure though. If you don't want to share, this is totally just a spur of the moment. Nobody's teed up for this, so that's totally fine if you're not happy to sort of share. But just wanted to give you an opportunity if there was anything that you found from participating in this program that you found were helpful or challenging or interesting. If you want to jump in at the end as well, if you want to think about it, that's totally fine. There's no pressure, but just thought give you a chance. So thinking about moving forward, now that the program is wrapped up, we don't want you to just lose everything that's happened during the program and the momentum that you've gained and the small little changes that you've implemented or tried to put into practice in your through your PDSA cycles. So we're looking at the sort of sustainability of quality improvement. Sometimes it's called continuous quality improvement, but yeah, it's looking at what you can do to maintain the momentum. So I just want you to keep it on your mind, what you've been doing. Keep thinking about the data cleansing, the updates, the recalls that you can be putting in place for the patients that are overdue for the screening. Those ones are good ones to focus on at this stage as well, but also consider the other ones, and you can put reminders in for 5 years when the next screening comes, or 2 years. So it's all about that side of it as well, sort of thinking about how to, I guess, create the sustainability of quality improvement. And there are lots of examples on that slide there that you can have a little look through and get some ideas. I will send through this presentation at the end, so you will have a copy of this. But it is some of the things that we've looked at during the course of the program, and I think the data can give us a good idea of a good place to start. But then you can also think about how you might reach out to those patients, or what you'll do internally in your practice or in your practice software to help remind you to just engage with patients who are overdue for their screening. I did just want to do one quick little example of the action plan. I know some of you have already got this done, but just for those of you who are still working on the action plan, just wanted to give you a little bit of a snapshot of what it looks like. It's sort of basically a mini PDSA cycle. So it's sort of working on the same sort of template that we've been doing. It's just all here in one action plan. And you look at kind of implementing a couple actions that you'll do moving forward. So just wanted to look at this action number 2 here. You might want to connect your practice software to the National Cancer Screening Register. And I know some of you have already done that and some of you have struggled with that. We've had some challenges. But we'll just look at it as an example. So you can sort of see here, it's the who, when, supported by, completed by, and comments. So it's like the PDSA cycle, just condensed down into one little row. The template that I sent through is you can fill it in digital copy, or you can print it out and have it as a hard copy as well, whatever sort of works. So you can see here that who will complete this. It's going to be Joe, the practice manager. They'll do it on Thursday. Doesn't need anyone else's support for that, and it will be completed by Thursday as well. And then the follow-up from that is that the practice manager will make sure that the other staff know how to use and connect to the National Cancer Screening Register through the practice software. So whether that will be just a quick little mention at a staff meeting or just individually, opportunistically with the health practitioners. So that's just a small little example of what you can put in your action plan. And just finally, to wrap up, these are the final steps. The final deliverable items that are due, I've sent out an email a couple of weeks ago with the final items for each of your individual practices, but feel free to touch base with me to, if you're just wanting to check which ones are still due, or if I've got that incorrect, please feel free to tell me. But yes, we're here to support you get those final items done. So in the wrap up of this, I'll send out the presentation, the benchmarking reports will come with the data, and the final items will be collected so we can help support get those final items done. We can come out and visit in your practice and do that together in person if that will be helpful. Otherwise, there's lots of examples and templates that you can use as well if you're feeling comfortable to do that. There are some resources which you can access as well. So that will be included in the, when I send out the presentation, you can access these links as well. And that brings us to the end. So are there any questions that you've got, or are we all good? Thank you again, Natalia. Really appreciate having you here, having your insight and your expertise from Cancer Council joining us, and we really appreciate your time. So thank you so much for that.
Thanks, Rebecca. Thanks, everyone. Have a good evening.
Thank you. I'm going to just stop recording now.